Okay. Now I have some wake-up questions. Which of following agencies, okay, are not absolutely safety standards and governance, are not about safety standards and governance? Okay, I'm reading again. Which of the following agencies is not about safety standards and governance? OSHA, Clinical Laboratory Science Institute, Standard Institutes, CDC, ASCP, American Society of Clinical Pathologists. Okay, one more. Let's see. Show your responses. Okay, this is a association about our profession, but not about the safety standards. The correct answer is D. Okay. Okay, good. Now, okay, which of following agencies governs the preventive precaution to prevent laboratory staff from potential infections, bloodborne pathogens? Okay, there are two agencies. They establish a standards to prevent potential infectious bloodborne pathogens, to prevent stuff from the potential infectious bloodborne pathogens. Okay, you also to know the abbreviation of each institutions, okay, such as OSHA or CLCI, Clinical Laboratory Standard Institutes, CDC, ASCP. Okay. Now see your answers. Okay, OSHA, okay, and CDC are two institutions which establish a standards to prevent staff from potential infectious bloodborne pathogens. I'm sure you heard CDC's guidelines during the last 1 year a lot, right? Okay, that means, okay, now I'm going to show you the correct answers. Okay, OSHA. It says only OSHA. Okay, you are right. Okay. Okay, OSHA. I need to be sure. Okay, I let you know if something's wrong with this question, but now the correct answer is A. Okay. However, I am not sure. I am going to double check it. Okay. Okay. How you can prevent most laboratory accidents? Exercising good techniques, staying alert, using common sense, all above, none of the above. I hope that this question help you to understand better, to integrate different issues. Okay. Okay, all above is the correct answer. Good job. Okay, one more. Which of following equipment is not included in the PPE, personal protective equipments? As you watch in the videos, okay, I still didn't mention, but you already watch in the videos, just in a last few minutes. Lab coats, regular strict glasses, gloves, face shield, respirator. Okay, let's see. Lab coat is PPE equipments. Regular strict glasses. What about this? Is not a PPE tools, right?
By lab coat, do you mean like the gown that you put over your scrub?
No. Lab coats, also gown, gloves, face shield, respirator. These are all PPE tools, okay? But regular street glasses that now I am wearing is not, yeah, it is not included in the PPE, okay? However, there are glasses, yeah.
I thought you had meant goggles, like.
Say again?
I thought you had meant like safety goggles.
No, this is not, as I mentioned, regular strict glasses, okay? Which now I'm wearing, okay? Is not safety glasses, okay? Okay, it's tricky, huh? Okay, don't worry. We are in a process of learning. Okay, let's go ahead now. Okay, exposure control plan is, as I said, is a plan which OSHA mandated program or plan is about occupational exposure to the bloodborne pathogens and is required for each lab to establish such plan and implement in a daily works, and which helps the lab staffs to know how to manage and handle medical waste in a safe and effective manner, and also helps the lab staff protects themselves from the potential infectious bloodborne pathogens. Okay, what does means each lab should develop, implement, and comply with a plan which is known OSHA mandated plans, also exposure control plan. It is really crucial for each of the single clinical laboratory. Now, in terms of a exposure control plan, all employees who handle hazardous material and waste must be trained to use and handle these materials, okay? And also the chemical hazard education session must be presented to new employees and conducted annually for all employees. Okay, each laboratory requires to evaluate effectiveness of its plan and make a change if is needed. Okay. Okay, biohazard is a definition, okay, which defines infectious materials or agents that present a risk or even a potential risk to the health of human or an animal in the laboratory. Okay, what does risk means? Okay, risk is defined as the probability that a health effect will occur after an individual has been exposed to a specific agents, material, or chemicals. Okay, biohazards denotes infectious materials or agents that present a risk, okay, to the health of humans in the laboratory. Okay, biosafety means reducing the risk of unintentional exposure to a pathogens and toxins or their accidental release. Okay, biohazards is a definition of materials which include a risk, a potential risk to the health of the lab staffs. Biosafety means reducing the risk of unintentional exposure to the pathogens. And a biosafety management plans addresses the laboratory practice and procedure designed to reduce risk of associated with a potential biological safety hazards. Okay, is a biosafety management plans which includes some standards, some precautions that reduce the risk to be exposed with a biological safety hazards. Now, biosafety practices apply safety precautions that reduce a laboratory staff member risk of exposure to the potential infectious microorganism and also limit contamination of the work environment and ultimately the community. Okay, avoiding transmission of infection disease. There are laboratory-acquired infections and blood-borne pathogens. And to avoid the transmission of infection disease from these two sources, we need to take some precautions. Okay, let's talk about the laboratory-acquired infections, which is defined as infections acquired through the laboratory or laboratory-associated activities, regardless of whether they are symptomatic or asymptomatic in nature, okay? And most frequent routes of exposure and accidental inoculation are inhalation or percutaneous inoculation, contact between mucous membrane and contaminated materials, or ingestion of the materials. these are routes of exposure for acquired infection disease. Okay, blood-borne pathogens, okay, are they are an occupational exposure. They can be via through occupational exposure, which is via percutaneous injury, such as needle stick or cut with a sharp objects, or a contact by mucous membrane or non-intact skin with a blood or other body fluids. Okay, these two, with these two ways, via a percutaneous injury or via a contact by mucous membrane or non-intact skin with other with blood or other body fluids, the blood-borne pathogens can enter in our body and cause infections, which we call blood-borne infections. Okay, now the likelihood of infections after exposure to blood infected with hepatitis B virus or HIV depends on a variety of the factors, such as the concentration of the viruses, or the duration of the contact, or the presence of a skin lesion or abrasions on the hands or exposed skin of the healthcare workers. Okay. Also, the immune status of the healthcare worker for HBV, HBV, hepatitis B viruses, is also important, whether is vaccinated or not. Okay, it may protect the healthcare worker, even though he or she exposed to the HBV viruses. Okay, now let's talk about safe work practices for infection controls. Most of them are really easier to follow, but they are essential for each lab staff, each healthcare worker to follow them. Okay, as I mentioned before, personal protective equipments, okay, selection and use of gloves, facial barrier protection, or occlusive bandage, laboratory coats and gowns as a barrier protection are really important. And other factors such as nail care, shoes, electronic devices, okay, and hand washing, decontamination of work surface equipment and spills are also important safe work practices that we need to know, okay, in order to control infections. Okay, some of the safe work practices are as follows, such as disinfections, which describe a process that eliminates many or all pathogenic microorganisms, okay? And objects usually are disinfected by liquid chemicals or wet pasteurization, such as autoclaves. And disinfecting solutions include alcohol, iodine, or hypochlorite, such as bleach. And also we know that hypochlorite is most potent disinfecting agents. Okay, this disinfecting procedure is used on non-disposable equipments. However, disposable labware or supplies that have come in contact with blood should be autoclaved or incinerated. Okay, the general infection control safety practice include pipetting safeguards such as automatic devices, safety manual, and sharp safety and needle stick prevention. Okay, for that we need to use a special sharp container, and also you shouldn't recap, bend, or break sharp needle or lancet devices by hand. Okay, using a special sharp container. Okay, and do not recap, bend, or break sharp needles or lancet devices by hand are two important preventive actions that we need to know, we need to follow. Okay, other issues about the general infection control safety practice is about transport and handling of diagnostic specimens. It can be blood, urine, or other body fluids. Okay, specimens should be transported to the laboratory in a plastic leak-proof bags, and protective gloves should always be worn for handling any type of the biological specimens. And such as Zika, COVID-19, they are within the United States as a category B biological substances. We need to take all the precautions that we mentioned before, okay, such as wearing gloves, okay, or face shield or mask and other safety goals we need to follow. Okay, some laboratory safety practices is also important to protect ourselves and our colleagues are as follow. All devices in contact with blood and capable of transmitting infections to the donor must be sterile and non-reusable. Okay, as we watch in the videos, food and drinks should not be consumed in our work areas and should not be stored in a same area of the specimens. And containers refrigerators, freezers used for specimens should be marked as containing of biohazards, as we see on these slides. Okay, other practices can be specimens needing centrifugation should be kept and placed into a centrifuge with a seal dome in order to protect ourselves, and rubber or stopper test tubes must be opened slowly and carefully with a gauze square of over the stopper to minimize aerosol productions. Okay, other dilators or safety valves should be used for pipetting. Okay, pipetting of any clinical materials by mouth is strictly forbidden, and no tobacco products can be used in the laboratory. Okay, no manipulation of contact lens or teeth whitening strips should be done with gloved or potentially infectious hands. And of course, no lipstick or makeup should be applied in the laboratory. All persons should be familiar with a location and use of eye wash station and safety shower. Okay, now let's have some questions. The infectious materials or agents that present a risk to the health of the human in the laboratory are known as specimens, byproducts, pathogens, biohazards, recycles. A tricky question. Okay, let's see. Biohazard is correct. Okay. Don't get confused with pathogens. Okay. Pathogens may include it in biohazards. Okay. But the general names definition for that is biohazards. Okay. Good job. Now I am going to clear them. Next one. Which of following is not a way of percutaneous inoculation of blood-borne pathogens occur? A percutaneous injury via needle stick, a skin cut with a sharp object, ingestion of the infectious material, contact by non-intact skin with a blood or concentrated viruses. Okay, which is not a way of percutaneous inoculation. Go ahead. Come on, guys. I still don't see any results.
I don't think it went through.
No? Okay. Okay. The correct answer is ingestion of the infectious material. Okay, you may know what does percutaneous inoculation means. Okay, percutaneous means only via the skin, through the skin. Okay, if any pathogens enter through your skin in your body, we call percutaneous inoculation. Okay, and okay, the correct answer for this question is C. Okay. Okay, thank you that you sent a response to these questions. Okay, this is most important step that you already took. Okay, one more. The blood-borne pathogens that laboratory staff most commonly facing is HIV, HBV, COVID-19, HAV. Okay, most commonly facing pathogen. Okay, let's see. HPV is the most common one. Okay, correct answer. Good job. Now, one more. Which of following action is not a safe work practice for infection control? Using the personal protective equipments, using laboratory coats, gown as a barrier protection, hand washing, circulating the fresh air, the contamination of work surface, equipments, and spills. Easy peasy. Don't be afraid. Send your response. Okay, now we are in the process of learning, right? Okay, circulating the fresh air is the correct answer, okay? Is not a safe work practice, okay? Okay, now another tricky questions. Most effective disinfecting solution to eliminate HIV and HBV is alcohol, hypochlorite, iodine, vinegar, and betadine or betadine. We are using most of them, but one of them is most effective. Okay, hypochlorite bleach is most effective one. Okay. Good. Okay, let's go ahead. As I said, specimen handling and shipping is also one of the steps in a procedure of the lab, and proper handling of the blood and body fluid is critical to the accuracy of the laboratory test results. Okay, if you don't handling a blood or body fluids in a proper way, that means you get a wrong lab results, okay, and therefore specimen handling and shipping of this of the specimens is really important. Okay, now the safety of all individuals who come in contact with the specimen must be guaranteed. Okay, if a blood specimen is to be transported, the shipping container must be meet the OSHA requirements. And I am going to show you, as you see, okay, on these slides, okay, shipping container must meet the packaging requirements of the major carriers and U.S. Department of the Transportation, hazard material regulation, and also the standard of the OSHA. Okay, as you see, there are labeled on the bags, and these bags are leakage-proof bags. Okay. Okay, now we have many questions in our minds. Okay, how we can prevent the transmissions of the disease. Okay, how can we protect ourselves from being infected by bloodborne pathogens? Now, I have some slides that explain these questions, okay, give an answer to these questions. Okay, as you see, okay, prevention of disease transmission requires many precautions, okay? Immunization, screening tests, prophylaxis, medical follow-up, record of accidental exposure, respirators or masks, and protection from aerosols. Now, I'm going to explain each of them. Okay, as you see, we can protect ourselves from some of pathogens via immunization, such as hepatitis B, influenza, measles, mumps, rubella, and varicella. Okay, and there are also optional immunizations for hepatitis A, meningococcal disease, okay, typhoid, and so on. For some staff which are under a risk of such pathogens, they may have also maybe vaccinated with such vaccines. Okay, now other preventive actions can be screening tests for, as you know, PPD for tuberculosis, okay, or screening tests for rubella or hepatitis B surface antigens, okay, in order to check whether you exposed to these pathogens earlier, okay, or Prophylaxis can be other preventive actions if you think that you expose it to some kind of the pathogens, okay, such as hepatitis B viruses, hepatitis C, or HIV, and then there are some medicines for prophylaxis, okay, and also medical follow-up and records of accidental exposure may be a preventive actions for such exposures. Okay, and respirators or masks for tuberculosis, SARS, or COVID-19 may be also a preventive actions to prevent disease transmissions. Okay, as you see on these slides, there are several pictures that show how to use personal protective equipments. Okay, I am sure you know most of them, how to use, how to wear them, or how to remove them. Okay, these are really important to protect ourselves being exposed to the infectious pathogens. Okay, now additional laboratory hazards such as chemical, electrical, fire, labware, and infectious waste, which also non-medical waste. We need to know how to handle, okay, with such hazards. Okay, specific hazards chemicals, okay, such as sulfuric acid, nitric acid, acetic acids, hypochloric acids, okay, and select carcinogens. And carcinogens are any substance that cause to develop cancers, non-cancer carcinogens. Also, we need to know how to protect ourselves from such kind of materials. Okay, the protective measures regarding to the chemical hazards. Okay, when any potential hazards solution or chemicals is being used, the protective equipments for the eyes, face, head, and extremities, as well as protective clothings or barriers should be used. It's based on the kind of the chemicals that we are using. And a volatile or foaming solution should be used under a fume hood in case of accidental contact with a hazardous solution or a contaminated substances. A quick action is essential. Now I am going to explain what can be actions to protect ourselves from such chemical hazards. Now, grounding electrical equipments, okay, are equipments that we are using in the labs, okay, and in the National Fire Protection Associations, they published national electrical codes, and what that means, all grounding electrical equipments should meet a national electrical codes in order to be sure that we are working in a safe space. Okay. The personnel also need to be trained in the use of safety equipment and procedure about fire safety, and annual training is mandatory. Each laboratory must have equipment to extinguish a fire in a laboratory and on clothing, and safety showers are essential. Fire blankets must be easily accessible in wall-mounted cabinets. These are all about a fire safety. Okay, and fire classifications can be class A, B, C, and D. It depends of the level of the flammable, okay, the ability of the flame of the materials. And based on this information, we classify the lab materials as a class A, B, C, D, and as you see, the class E, the last one, cannot be extinguished. Okay, labware hazards, other kind of the hazards. Caution must be used to prevent unnecessary or accidental breakage. Okay, and most labware currently used is discard when broken, and also we need to use any broken or cracked labware should be discarded in a special container, as we see on the slides for a broken glasses. This is a container for only specific for a broken glasses, and we shouldn't throw this broken glass in the regular waste container. This is a really important to follow these standards. Okay, common sense should be used in storing labware. The heavy pieces placed on the lower shelves, and also as we see in these pictures, the tall pieces placed behind the smaller pieces. Okay, and labware should not be stored out of the reach. Okay, in order to follow safety precautions. Okay, now I am going to stop here and show these. Also, you may watch these videos by tomorrow. Okay, then we save a time. Okay, as soon as we finish the chapter 2, I am going to give access to the exam 1. Okay, please watch these videos by tomorrow. Okay, because these videos is about laboratory safety. Okay, is about 12 or 30 minutes. Okay, we will save a time if you watch these videos before you come to the class by tomorrow.